Mhm.
The meeting is now live streaming. I'm going to go ahead and press record also.
Thank you. Good afternoon, everyone. I'd like to call the Health and Human Services and Aging Committee meeting to order. Wednesday, June 30th, 2021. And can we have a roll call, please, Madam Clerk?
Calling the roll, Ms. Conwell,
Present.
Mr. Sweeney,
Present.
Ms. Brown,
Here.
Mr. Miller,
Present.
Ms. Stevens.
Present.
We have a quorum.
Thank you. Was there anyone that signed in for public comment?
No, Madam Chair, no one submitted any public comment.
All right. Before us is the approval of minutes from the June 16th meeting. Can I have a first and a second, please?
First, I move.
Second, Brown.
Moved by Miller, seconded by Brown. All in favor, please say aye.
Aye.
Okay. Minutes have been approved for the June 16th, 2021 meeting. We have one item that is referred to the committee today. And in a second, we'll have the Madam Clerk read that into the record, but I had asked additional questions in regards to the legislation prior to this meeting, and I did forward those all to the committee members. So hopefully you had a chance to look at them. Madam Clerk, if you could please read it into the record.
Resolution number 2021-0160, authorizing a sole source contract with Enterprise Community Partners Incorporated in the amount not to exceed $1,155,000 to promote the Earned Income Tax Credit, Child Care Tax Credit, and provide free tax preparation assistance to low and moderate income individuals and families for the period of July 1st, 2021 to June 30th, 2024.
Thank you. And sole source has always been a sore thumb to county council, so I made sure that was one of the questions that was asked and it was answered. Who today is presenting this contract to us?
Madam Chair, David Merriman, Director of the Department of Health and Human Services. I'm here today with my team. I know Paul Porter is going to introduce the item and walk it through. We also have members from the organization. I just remind all of our visitors that are here on behalf of this item, you can stay muted until it's an opportunity for us to answer any questions. Kick it over to Paul.
Thanks, David, and thanks, Councilwoman Conwell and committee members. As was introduced in the agenda, this item is a 3-year agreement for management of the Cuyahoga County Earned Income Tax Credit Coalition. Enterprise Community Partners has led this coalition since 2004. And during that time period, these services have been authorized as both a sole source and an RFP award for prior contracts. Enterprise was the only respondent to 2 prior RFPs, one of which was issued in 2011 and another in 2014. When this contract was posted as a sole source in 2019, 2020, and then this year for this contract period, no other vendors submitted a proposal in response to that posting. So when the county does a sole source contract, it has to be posted in order to allow other vendors who might want the opportunity to deliver this service to have a chance to submit a proposal, and nobody else did either this year or the 2 prior years. We're pursuing a 3-year agreement in this case versus a 1-year agreement that we've done in the past, as an acknowledgement that there aren't any other vendors who are interested in delivering this service locally. And this will allow the vendor to continue delivering services over kind of a longer, more consistent period of time without having to complete the lengthy contract and approval process each year. The annual funding amount for this 3-year period is $385,000 for a total of $1.155 million. That represents a slight increase from the $368,850 per year for the prior 3 contract periods. But in this case, the contract value is going to remain flat for each of the 3 years. So it'll be $385,000 per year for this year, next year, and the third year of the contract. As part of this contract, Enterprise continues to file thousands of returns each year for low-income taxpayers throughout Cuyahoga County. Through May 31st of this year, they filed over 9,000 tax returns, and that compares to 8,417 tax returns filed during the same period last year. This contract generates over $15 million per year in tax refunds for low-income county residents. And the kicker with this contract is that it generates that revenue for the county residents without having those residents pay expensive fees or interest rates on either tax preparation services or refund anticipation loans, which have become a popular product with some of the paid preparers on the market. For a little bit more information about the program and to address any questions you might have, we have Kevin Gowan, the Director of Cuyahoga Job and Family Services, on the line, as well as two individuals from Enterprise Community Partners, Mark McDermott, their Vice President and Market Leader for the state of Ohio, and then Kathy Matthews, Enterprise's Senior Program Director, who has oversight of this project. I'm happy to answer any questions, as well as Kathy, Mark, and Kevin. Thank you.
There, to the committee, any questions of Paul Porter, Kathy Matthews, or Mark McDermott in regards to this contract?
Madam Chair,
Councilman Miller?
thank you very much. And first, I'd say that that I support the idea of a 3-year contract. The need for these services is not going away, and you've made repeated solicitations, and this is the one vendor that keeps coming, and I'm not hearing any comment that we're not satisfied with the services that they're providing. So I think you're on the right track on this. And the first question I have is that I heard that that you were running these services out of 2 community centers, but that was suspended like a lot of other things because of COVID-19. And my question is if and when we're going to go back to providing in-person services for this program at the community centers.
Thank you for your question, Councilman Miller. Kathy, I'll defer to you to answer that one from a programmatic basis.
Terrific. Well, thank you for the opportunity here to be able to speak and answer questions. Specific to your question, we actually have 11 sites that we're operating in both a completely virtual process during this current tax season, and then in some modified in-person, meaning they would be greeted at the door, properly masked, socially distanced, and drop off their documents, and making arrangements to return and pick them up. So we were able to accommodate taxpayers throughout the season, or this past tax season, in both methods. We fully anticipate, barring anything unforeseen, to return to totally full in-person processes with the upcoming tax season. Although we have 2 sites that remain opened through October, and they too have returned to in-person appointments through October of this year. But we will fully anticipate being able to, barring anything, again, we can't foresee as it relates to the pandemic, of returning to in-person services at more than 15 locations next year, getting us back to like full service capacity as in years past.
So, Madam Chair, Ms. Matthews, by way of follow-up, when do you consider the upcoming tax season is starting?
So the tax year 2021 will commence mid-January of 2022.
Okay. And the other question I have is, to what extent we're going to use this program to also encourage and help people to do what they need to do to qualify for the new child care tax credit? And if so, how are you going to do that?
So if I can answer that, unless somebody else would like to, but in response to that specific question, we are working very aggressively with our partners in producing flyers and materials that promote the advantages that have come to light with the new advanced tax credit, the new advanced child care tax credit, and are working with community partners to distribute that information, making sure that those who are now eligible, who may not have been in the past, so specifically individuals who did not have income previously, are now eligible for the child care tax credit. So we want them to know about it. They've also increased the eligibility. So children who are now 17 are included where previously they were excluded. There are also increases to the child tax credit this year, or with this particular tax year, as a result of the American Rescue Plan, where previously it was $2,000 per child. It is now $3,600 for children 0 to 5, and from 6 to 17, it is $3,000. So we're doing as much as we can to raise awareness and promote it. We also are working hard to make sure people understand how to claim it. So first and foremost, those who don't have income obviously aren't required to file a tax return. So we are providing assistance we can either file a tax return, and there's a way we can do that, as we learned with the economic impact payment, and way in which we can file a tax return even though there's no income, or individuals can go to the IRS website and apply for the child tax credit through a portal that the IRS has set up. We also provide assistance, as we did with the economic impact payment, for those who may need assistance, meaning they don't have a device or reliable access to the internet. We'll provide assistance over the phone so that anyone who is eligible that does not have access has a way in which they can claim not only the child tax credit, but even those who have yet to claim the economic impact payments.
Well, thank you for that response. And there aren't any programs that do more to reduce economic inequality than these two programs, the EITC and the child care tax credit. So it's just very important work, and it's an important part of our disparity and diversity efforts. And so I support the program, and thank you for all the work that you do.
Thank you.
Madam Chair,
Yes.
if I may also, and just in response to Councilman Miller's question request, we are also exploring some media campaign opportunities that would allow us to leverage what the Earned Income Tax Credit Coalition is doing, and also hopefully some federal materials. So DHHS Comms is looking at what sorts of media we will also be doing. So there will also be some county response on this as well.
All right, thank you. In terms of the 11 sites, Ms. Matthews, can you send those to Levine, and she can get those out to the committee?
Absolutely.
Thank you. Any other questions from my colleagues? Mr. Sweeney?
Thank you, Madam Chairwoman, Director, and Paul, and the rest of the team. Incredible, didn't know anything about this. It's just mind-boggling how much help you can give the folks that need it the most. Just with, you mentioned last year at 8,000, this year at 9,000. At this point, is it going to run through the rest of the year? And what number do you think you're going to get to?
I think we'll get to 11,000 this year.
There's a spike in the beginning through the chair?
Correct.
Pre-pandemic, was this program in place? And if it was, what were the numbers then? And I'm just thinking there might have been a dip because of the pandemic.
There was. Prior years, we've been preparing between 13 and 14,000 returns. So while there was a dip, I would be remiss if I didn't fully acknowledge the support of our partners and incredible volunteers throughout the community who were willing to step it up and embrace new processes and procedures to make sure that the community was being served.
Yeah, and through the chair to our director, you hit it right on the head, just promoting the heck out of it. What population do you believe we're missing? Is that a number that could be guessed without, holding your feet to the fire?
It's estimated that 1 in 5 are eligible for the earned income tax credit that are not claiming it. So we are continuously looking for ways to raise that awareness and make sure people are eligible. Specific to this year, more so than ever, there are going to be individuals who were unaware of the benefit of the earned income tax credit as it relates to their income. There are income thresholds that who, due to furloughs, layoffs, and lost wages, will be eligible this year that they may not have been in years past. So we have a pretty comprehensive marketing plan in place, along with outreach through very targeted, specific community partners who serve or support individuals who might be most likely to be eligible, making sure that we are doing everything we can to make them aware of, and then support them in whatever way we can to either file a tax return and or support them through these other channels that the IRS has created to make sure that they're claiming these credits.
You're very professional in your answers. Madam Chairwoman, two more maybe?
Yes.
Thank you. Just the biggest barrier or hurdle in regards to people responding, are they afraid to do it because, oh my gosh, it's the government? And I have a thought on how to get over that a little bit. Is that one of them, you think?
And when you mean respond, what do you mean?
You said 1 in 5 don't respond.
Oh, they're just not aware that they're eligible, meaning
So
that there's an income threshold that they need to, either be below or meet, and there's requirements, and it's a tiered threshold based on your income, number of children. And so they're just, as I said, their status might change throughout the year, that they just are not aware that this credit is available to them. And it's a little complicated. That's why it's really important to have programs like this that are trained and focus on making sure that as people are getting their taxes done, are able to responsibly claim this credit and make sure that that they are claiming it, not only that they're eligible, but they are indeed then claiming it. So we're looking for it based on their income, the number of children, and those types of things.
But you don't think there's any, oh my gosh, it's the government, I don't want to do it kind of thing, and we have to, during our program?
I've not heard that before. That's not one reason that I've heard consistently on why people wouldn't claim it.
Yeah, that's just my thought process, and just getting the message out, working through the director's office and all the partners. I don't want to discount county council or even city council to be able to use their mechanisms to get the word out to, help validate that it's important and get out there to understand it and try to move that number from 1 to 5 to, everybody's getting it to the best of our ability. So thank you, Madam Chairwoman. I appreciate it. And Kathy Matthews, appreciate your very specific answers. And Paul.
Thank you, Mr. Sweeney. Thank you, Mr. Sweeney. If you wanted to see the specific numbers that were quoted for each of the previous years, you can take a look at the responses that I forwarded to you earlier today.
Thank you for telling everybody I really didn't read them all. But I will.
That's okay. I know
We
we're
need to
very
be checked in the board once in a while, or more than once in a while.
Paul, I have a question. When Paul states that the funding will remain flat for each year, the 385,000, if there is an increase in family needs for the upcoming tax year, how will we remain flat?
Sure. Thank you, Councilwoman Conwell. So because this is a 3-year agreement, we have it structured as $385,000 per year. This one, actually, the agreement that expires today, we ended up having to do an amendment to add additional funds to that agreement. And it was just approved by the Board of Control on Monday because there were additional costs related to delivering these services during the pandemic, specifically some of the software they had to deploy to be able to schedule virtual appointments and then capture signatures in an approved method by the IRS virtually. So what we would do in cases like that, if there was additional need during one calendar year, we would add funds to the contract by amendment. The way that this is structured, it's not 1,155,000 all at once. It's structured as 385,000 for the first program year, the same amount for the second program year, and then the same amount for the third program year. If we wanted to make an adjustment to that, that would require an amendment in each of those years.
Okay, and going forward, when we have amendments through Board of Control on these major contracts, please send that to me so I can
Certainly
keep up. Thank you. Any other questions from my colleagues in regards to this contract? Okay, seeing none, hearing none. We can move this forward. I believe, Paul, you would like second reading suspension?
If we could, because this is a July 1 start date. Thank you very much, Councilwoman.
All right, we're getting better. One day
We
we'll,
are.
we're getting better, closer. All right, so can I have a motion and a second to move this to the full council under second reading suspension?
So moved.
Second,
Okay, moved by Stevens and seconded by Miller. All in favor, please say aye.
Aye.
Aye. Thank you. It has been sent to the full council. Thank you, Paul. Thank you, Director.
Thank you.
Madam Chair, if I could just say before we move off this item, I want to acknowledge that Kathy and Mark and the rest of the enterprise team, they've really been great to work with in this pandemic. I know that Kevin has worked closely with them on a number of issues. And I feel like there are many challenges that this pandemic has brought on us. Some organizations have stepped up and responded. And I think I think the pandemic has actually helped them to really evolve and become a more responsive approach. I see that here, and I acknowledge Kathy and Mark and the rest of their team's great work.
And I also want to thank you, Kathy and Mark. We were taking care of some of the global issues that were happening, and you guys stepped in on something that we didn't even think about, other than personally trying to get our own taxes done. So thank you again for all that you did. Thank you. Thank you, David.
Thanks.
All right. Moving on, we have a presentation today from the Hitchcock Center for Women. It is located on Ansel Road. I don't know if I believe all my colleagues are somewhat in acknowledgement of the organization, but I wanted to bring them forth today. It is one of the centers that will be heavily utilized in terms of our diversion center when it comes to females if they are picked up for drug or alcohol abuse and do not want to, they want to volunteer and have a 9-day stay at our diversion center. The Hitchcock Center for Women and Children would be a place that they would be given rescue after that if they do not have housing. So it is a connectivity to what the services we already provide, and very key, and the only center in Northeast Ohio that provides housing for our women that have children that are still in their care while they are receiving treatment. So may I ask who will be presenting today?
Thank you, Councilwoman Conwell. Karen Hutchins, our clinical director, will be presenting today. I thank you for that warm welcome. Hitchcock Center for Women really truly appreciates the opportunity to present to the Health, Human Services, and Aging Committee. I will turn it over to Karen for the presentation portion, and then we'll be happy to answer any questions that the committee has. So thank you again. And again, Karen Hutchins, she is our clinical director at Hitchcock Center for Women. She oversees all of our clinical services and covers for me in the executive director role when I am out. So Karen, I'll turn it over to you.
Thank you. I just need to know how to bring my slide up, my presentation.
Ashley?
But don't know if I have control to do that.
Madam Clerk, if you could answer that for her, please.
Yes, we have enabled screen share in order for you to share your presentation.
Karen, if you're having any trouble, I can bring it up as well.
Let's see if this works. Is everybody seeing the slide?
I'm seeing it.
yes, I'm seeing.
Okay, we're good to go then. Thank you very much. Well, again, thank you for having us today to be able to present to you regarding the services in which we provide at Hitchcock. So our mission at Hitchcock is primarily to support women and their families in the area of substance use. Compared to placing the child in the foster care system, we provide our treatment at just a fraction of the cost to our community. Hitchcock provides a stable and supportive environment for mothers and their children to live in our historic campus. We also provide treatment while children are living with a relative so that the mother receives the support in which she needs. We are known to be a place where healing begins. And it's much more for us than a slogan at Hitchcock. It's the way we go about our business, the business of helping women help themselves to become better. Our goal is to help women to actually establish a platform in which they can then go back out into the community and live a life of sobriety. How did this all begin? It began in 1970 when Jane Mazzarella, a nurse who was working at the Cleveland's Women's General Hospital, recognized the prevalence of substance abuse among her patients, her female patients to be specific. She was a strong advocate with ties to the recovery community. Ms. Mazzarella mustered the financial, the political, and the grassroots support necessary to open a 10-bed women's halfway house in 1978. So Hitchcock was originally housed in a home on Magnolia Drive that was donated by the Hitchcock family, and at the time was called the Hitchcock House. The agency purchased what is now, which was formerly the St. Mary's Seminary on Ansel Road in Cleveland, near East Side, and this was done in 1992 from the Cleveland Catholic Diocese. We continue to be located at the former South St. Mary's Seminary today, and we have a strong presence in the Cleveland's East Side. So these are just a few photos of our facility. It's a facility that I affectionately call the museum. Number one, because of the age, and number two, because of the beauty of it. We have in the bottom left corner a magnificent library. We also have a chapel down in the left corner. As, again, we were a seminary for men who are going into the priesthood. In the top right corner, you'll see the division of the building. On the south side of the building, which is the top side, is where we have our residential housing for women who are in treatment. And then on the bottom side of the facility, which is the north end of the building, is where we have our recovery housing, which is where we continue to provide support to women even after they've completed treatment. These photos here show one of the things that's very important to the women when they come to our facility is the number one question is always, do I have to share a room? All of our rooms are individualized unless, of course, they have children. So they have to share their rooms with their children. But on the far left, you'll see where a person has actually personalized their living space. The middle, the top middle, and the far right corner are our classrooms or where treatment, group treatment happens. The far right is also a room where we can use to remove the tables and it becomes a playroom for the children. I don't know if you can see some of the toys that are off on the sides. The middle bottom is our beautiful dining room area. Again, I affectionately call this historic. I love these windows, these arch windows. And then in the bottom corner, we have a gymnasium. So our scientific evidence-based methods gets results. Our treatment programs, we utilize the matrix model, some Hazelton approaches, and we bring in some of the community supports to help provide group services to our ladies. We have 61% of everyone that enters Hitchcock completes treatment. These are terrific numbers for this high population in which we serve. You will not find many providers that will share their numbers of completion. We provide full psychosocial assessments using the American Society of Addictions Medicine criteria in order to make diagnoses and to get our clients into a particular level of care for substance use treatment. And using the ASAM level of care, there are 6 dimensions in which they provide a risk rating for each one of them. Number one being the top one, dimension number one being withdrawal. Does this person have a potential for withdrawal? Two, does their substance use impact their physical health? Three, does their substance use impact their emotional health? Is this person dual diagnosed with a mental illness? Number four, are they ready to make a change? Five, is there a potential for relapse? And number six, what is their recovery environment like? So the ASAM level of care is broken out into 5 different categories. The first one being 0, there is absolutely no diagnosis and no need for this client to be recommended for substance use treatment, on up to level number 4, which is they need hospitalization for their treatment services. So for a little bit more of a breakdown on each one of those levels, level 0.5, client who might be diagnosed with either no substance use diagnosis or have had some consequences because of use, like an OVI or a DUI, or they might be even have just a mild diagnosis, might be recommended for early intervention or some type of classes, things that you would see that a person would enter if they were court ordered to go to like a MAD, Mothers Against Drunk Driving class. Level 1 is our outpatient service. This is our lowest level of service. That's actually for a person who's getting into treatment services. Level 2 is our intensive. It's more intense. It's a longer period of time in which a person would be into treatment. And under level 2 is also what we call partial hospitalization. Level 3 is our residential treatment programs. And a level 4, again, is detox or some type of treatment that is needed for 24-hour services of having nursing or a doctor or physician on staff. So our treatment programs, outpatient addiction treatment professionals are licensed here at Hitchcock. They either have a chemical dependency license, a professional counselor's license, or a social worker's license. These professionals have the experience and education to provide excellent, or what I also call optimum client care. Our inpatient program employs an on-site nurse practitioner who is capable of linking clients to medication-assisted treatment for opiate use disorders and also primary care appointments through our partnership with Metro Health. All treatment services are licensed by the Ohio Department of Mental Health and Addiction Services, also known as Ohio OMS or OMS. So where do we begin with our treatment services with Hitchcock? Our highest level of care is our 3.5 residential treatment services. This service is a 24-hour-a-day, 7-day-a-week treatment service that provides substance use counseling, and for individual counseling, group counseling, family counseling. We also provide the full continuum of care, including linkage to substance use counseling. If a person who we assess does not want to enter treatment here, we will facilitate linkage to another facility. We also provide linkage to medication assisted management if our nurse on site is not providing those services, as well as occupational and recreational therapies. By welcoming children up to the age of 12 to live on campus, this provides mothers with the ability to have treatment services without the worry of where their children are. At this time now that with COVID being lifted, we have the opportunity to have child care services that are just right around the corner from where we are housed. And also there's the Wilson School just down the street for our children to be able to go to school. During COVID, of course, everything was closed in and we made facility arrangements for our clients' children to be able to do online school. Addiction also affects the family, as we all know. Family members receive counseling, case management, and education about the journey to recovery so that they are made better aware of what it is that their loved one is going through. We have support groups that are now coming back onto the site, whether it be Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, or the Big Book. Those services are going to be provided or are provided to our clients. so that they will continue to have a linkage to ongoing care once they leave our care. We specialize in working with clients with Medicaid, treating the most at risk. We work with all managed care MCOs, excuse me, that Medicaid offers at this time. Research shows that those who engage with continuing care are more likely to remain sober. Hitchcock has a full ASAM continuum of care after residential treatment. When persons come in for their assessments, we immediately begin to let them know all of the services that they can be linked with or receive here at Hitchcock, such as intensive case management services, peer support services, who are people who have actually lived the experience, communication with family and the community. Work closely with children's services and or their probation officers, spiritual and faith linkages, and the 12-step inspiring programs. After a person steps down from our residential treatment, the next level of care would be partial hospitalization. This is a treatment plan and a treatment process that I explain to our clients that we don't want to throw you back out into the ocean. We are going to give you the same level of care that we did when they were in residential, but we're going to continue to hold your hand while we move you over from our residential side to our recovery housing side. So they will still be in treatment services, pretty much the same as what they were in residential. The only difference is they now have the freedom to enter back into the community while they still have that support system in place with us. After they finish this intense treatment through a partial hospitalization, they are stepped down once again to a less frequent level of care of intensive outpatient treatment, which meets 3 times a week for only 3 hours, whereas in residential, they're meeting 3 hours in the morning, 3 hours in the afternoon, and they have a support group meeting in the evening that goes on 7 days a week. Partial hospitalization, they're meeting 4 days a week, 3 hours in the morning, 3 hours in the afternoon, and on that 5th day, individual counseling sessions, and they are free to go into the community to find their support group help meetings. Intensive outpatient treatment, they're stepping down again to now only 3 hours a day, 3 days a week, with the intentions of also seeking support help meetings into the community. So as you can see, they're being given more and more leeway to experience the community while we still hold their hand and give them continued support and treatment for substance use disorders. The last level of care is the lowest level of care, which is non-intensive outpatient treatment. By the time they reach this, it's probably about 6 months after they started their residential treatment services. Is our non-intensive outpatient services where they work on a relapse prevention plan. By this time, they're only in treatment 2 days a week for 2 hours. So they're also working on other things like supportive housing. They're looking at employment. But what we don't want to do is to, after we finished with them here, is to let them loose into the community. They're able to continue to stay in our services, in our recovery housing side, for up to 2 years as they continue to get their feet set and ready to get back out into the community fully. So with recovery housing, we continue to offer 24 hours, 7 days a week support with our on-site care specialists. The recovery housing program assists in linking tenants to mental health treatment. Pretty high number of our clients who come in for treatment services currently do have dual diagnosis, mental health as well as substance use. And we also help them, as I stated already, linkage with employment opportunities and recovery supports. The entire housing team collaborates with our master's level social workers and counselors throughout the agency. So everyone works as a team, no matter which area we're working in. Hitchcock Center takes care of women in treatment while their children can stay in campus with them. This is one of the reasons why people seek after us who have children, so that they don't have to worry about the needs of their children. Children who are less than under school age are permitted to, we have play areas in the group rooms actually where children can be viewed by their mothers when they're actually developing some, maybe for the first time, are developing parenting skills. It gives them the ability to have their children stay here, is a game changer and something that no other residential provider in Northeast Ohio offers at this time. Our leadership in this space accounts for multiple requests by other agencies to provide consultation and community discussions about how we're doing the work in which that we are currently doing. Here's an example of the communities in which we serve. The top 5 communities that we serve is the Glenville, Garfield Heights, Edgewater, Huff, and Maple Heights areas. But as you see also on the left side of this graph, 50% of our population is from all over. We also serve clients that are coming to us from agencies in Akron, Ohio, from Medina, from Geauga County, Lake County, from Medina County. We get clients from Columbus and also Toledo. As an impact, as a leader in this area, 578 cases under Children's Services supervision are screened positive for illegal substances. Over 2,000 Cuyahoga County children are placed with relatives or in foster care at any given time. 66% of all clients at Aaron Hitchcock are currently mothers. There's an annual placement cost in Cuyahoga County totaling over $48 million. 88% of our clients are living in Cuyahoga County. Does our program work? 97% of our clients say that it does. Hitchcock consistently reviews the highest marks in our client satisfaction surveys as evidenced by our recent Adams Board Satisfaction Survey results. So here's our success stories. Numbers show one thing, but it's something else when you hear it exactly or directly from the client. So Liz B says, Hitchcock gives you the tools and surrounds you with loving and caring support. In the darkest of the dark, there is a light, and if you go towards it, you can find a life that is amazing and you didn't know existed. I walked from the dark place of addiction into this beautiful paradise of sobriety. And lastly, Diane S says, I know that there are many women out there who are just like me, who come from good families and good homes, but have a problem and might be embarrassed to ask for help. But there is a better way. Things will get better. Don't be afraid to ask. Thank you.
Thank you, Karen. We would love to answer any questions that the committee has or anything that we might have missed that you'd like us to go over.
Okay, thank you, Clinical Director Karen and Jason. I want to open it up to my colleagues in regards to any questions regarding the presentation.
Madam Chair.
Councilman Miller.
Thank you. I really appreciated the presentation, and it's just a very important set of services for which I'm grateful. And my first question is that alcoholism is notorious for being difficult to treat, and with high rates of failure and high rates of relapse. And my question is, from your many years of experience, what have you found to be the keys to success?
Coming back. Each time a person, as you stated, there is a high relapse rate. But each time a person comes back into treatment, they gain a little bit more. They gain a little bit more strength. They gain a little bit more understanding. They gain a little bit more hope. And here at Hitchcock, we are welcoming people to always come back. One of the things that we do when we go to a doctor's office is we schedule that next year's follow-up or the 6-month follow-up. We're trying to change the culture here and take away the stigma of substance use disorders by letting the people know that, this is a medical necessity as well. When you need to have a follow-up, come back. Changing language is very important. Going from talking about sobriety to being in remission. Those things mean different things to different people. So changing the culture, changing the language is also helping people gain more and more sobriety and lasting even longer. Unfortunately, with life situations, not everything is going to be taken care of in one setting. People will run into things that they didn't encounter before. Life happens. They may not have learned how to deal with that particular situation. We recently had a person come back after 20 years of sobriety, but they knew to come back because they knew that they got help when they were here.
And just to add on to what Karen said, I think that as she pointed out, the overarching goal is to transition someone from professional supports to natural supports. So when they first come to us, they don't have a lot of professional support. They don't have a lot of family that they could reach out to. They don't have a lot of community supports, whether that's church or activities, things like that. So our goal is to, one, stabilize them with our professional supports, but with the long-term goal that we know that natural supports are going to be the best. And we have to really work with family, community, friends, education, employment, those factors to sustain long-term recovery.
Okay, thanks very much. And the other question I have is, you mentioned about parenting skills. Does Hitchcock House have its own parenting skills training program, or is this provided by somebody that you bring in to provide that service?
So we don't have parenting classes per se, but it's a part of our curriculum to assist clients with parenting. On the weekends, we do have what is called life skills classes that we do have for the clients, and parenting is also a part of that. We are also partners with community support agencies that have come in the past, but because of COVID, we're not able to come in to the agency to provide parenting classes. So now that things are beginning to open back up, we will be able to offer those services once again.
And Councilman Miller, I mean, to your point, education is one piece of what we provide, but we find that within the short sort of acute 30 to 45 day stay that they are within residential, we found really significant gains by having family counseling on site. So we do try to invite relatives, friends, family members on site to partake in counseling because we know that with that additional support from community that they'll be better set up for success. So our goal is more to move forward with repairing and linking with those relationships in the acute phase, and then continuing on with education and support, whether that's AA parenting class, et cetera, after the intensive focus of treatment.
And you mentioned about medically assisted treatment for opiate addiction. Do you use that for alcoholism as well, or only for?
No, we do use it for alcohol as well. So we partner with Metro Health, and they use it for alcohol. So we use it for alcohol as well, if the client's willing.
And final question, is your program the total abstinence is always required, or are there any exceptions to that?
Well, we know that total abstinence is always the long-term goal, but we do not immediately kick people out of treatment for what we would call a lapse. So a lapse is what we think of as a brief, mistake. That we want people to really kind of focus on quickly rebounding to get them back on track. Yes, we obviously attain abstinence as the highest goal. However, as someone continues along that journey, we look at the stages of change and how we support them throughout their treatment.
Thank you very much.
All right, any other questions?
Thank you.
Any other questions from my colleagues? All right. I always say one of the, who is that?
Would I be able to say just one?
Yes, go ahead, Jason.
So I know that there's always sort of, the biggest barrier is sort of, the question from the community about, what we need, what could help, Hitchcock, what are the barriers? And I'd say just to get it on the community's mind right now, the two biggest barriers that we're finding currently are one, just in terms of the building. So we're working through processes with the building, making sure that we continue to try to keep it moving forward as much as possible. It is an older building. And that secondly, looking at trying to get more people into the field. So we are partnering with the local ASAM board and the community to try to get more people into the field because frankly, we're finding that the difficult is a community at large to bring people in to the field. So I did just want to get those two things out there to the community at large in that we're working to continue kind of support those countywide. Thank you.
Thank you. As I was going to state, one of the key items to recovery and a continuum of care, we all know, is housing during treatment and after treatment. That greatly impacts the continued success for all the individuals that need this type of treatment. So I know a few of us are very proponents of for housing in all kinds of categories, but this is definitely, from my opinion, is definitely needed. I just wanted to let that my colleagues know, if they don't know already, that in many of the presentations, I believe in connecting the dots. So I bring these presentations from various agencies before this committee to share how they're impacting our communities, to acknowledge their continued needs for the community, how to assist as partners to Cuyahoga County's mission. Most of them are partners with us, and to hear their needs as an organization going forward as well. So I believe in partnerships. I believe in connecting the dots. And I know sometimes we have busy schedules, and I try to squeeze in the presentations with the contract, but they're important, and they're important for us to hear. And we're glad that our partners take time out of their busy schedules to inform us of what's going on, what is needed. We see the big numbers, what is needed in getting the drug and alcohol and all the numbers down, but all these things connect. Housing is one of the key things that relate to everything. So I'm very thankful that you guys took the time, Hitchcock Center for Women, coming out. I would also like to state that maybe we could work on a physical tour of the building, possibly on a Friday, since we are going back to count, to our chambers, maybe our timing will open up. I don't know if that is something permissible with you guys since COVID. Can you share a little bit about that, if that's possible at this time?
So yes, it is possible. We don't typically do tours into the private rooms and kind of the private areas, but certainly, yes, we can do a tour. And I will point out, Hitchcock has not reduced capacity throughout all of COVID. Now, part of that has been good because we have had the ladies be able to have separate rooms. So we do have that luxury, as opposed to a shelter or some of the temporary living sites. But I think more importantly, our board and our team has just been tremendous on really putting the goals and the needs of the ladies, sometimes even ahead of their own. And with that being said, we've been following the protocols to a T, and I can report, at least on our residential side, we have not had one instance of COVID since the outbreak started.
That's very good. Outstanding.
We're proud of it. I'm great. I mean,
that's very good. Do you think that that attributes to most of, you didn't have that many new intakes during the time, or what?
We actually saw, especially over the last 6 or 7 months, we've seen a nice increase in the number of intakes and admits. I think it just appears to be more to our protocol, and I think also more towards the team's willingness to be on site. They did not work remote. We did not really offer a full array of remote since we're residential recovery housing. We have to be here. So it was every person here on site, and everyone, was dedicated to the mission and really kind of stepped up. So, I think we believed in the protocols and our practices, and we've had good luck with that as well.
And that wasn't to say that we didn't turn some clients away because they came in with symptoms. We did have a couple that did, because we did the protocol of testing by doing, asking the questions and doing the temperature checks. So those who came in with either a high temperature or stating that they felt sick, they were not permitted to come into the facility.
Okay. All right. If you could share your, Karen and Jason, if you could share your contact information with Levine. There's a couple questions offline I'd like to ask in terms of around the COVID conversation as well.
Certainly.
And everyone should have Levine's contact information. All right, any other questions or statements from my colleagues to the Hitchcock Center for Women? All right, hearing none. Thank you again for attending and sharing your presentation. They all have that. Martin he'll pull his up and actually read it all the way through. And
Absolutely.
thank you, Marty.
Thank you for inviting us.
You're welcome. And for miscellaneous business, sad to say, this will be our last virtual HHS committee meeting, and we will return back to chambers on July 6th for regularly scheduled council meeting. Thank you all that are listening that have endured some of our technology issues that occurred during the committee. I know I had one major one that happened during mine, but thank you again. And if nothing else holds our time of attention,